to proceed. Our special guest speaker today, in a meeting that is being live streamed, so it can be picked up by those who are not on our normal Chai Chat, is called Diabetes and Your Heart. And I'm delighted that our guest speaker is someone who is regarded as one of the experts in this field. Dr. Onkar Sahota is a GP principal at Greenford Avenue Family Health Practice in West London. He also chairs the London Assembly's Health Committee, which is why we're here in London talking to him. He graduated in medicine in 1989 from Sheffield University, and he went on to study at the London Business School, where he got an MBA. He is a fellow of the Royal College of General Practitioners. And in a week when we actually acknowledge the 60th anniversary of the death of John F. Kennedy, he actually has studied at the John F. Kennedy School of Government at Harvard in Massachusetts in the United States. He's been a family doctor in West London since 1989 and maintains GP surgeries in Hanwell and Southall, serving over 10,000 patients. He is also the man who runs health in London as the chair of the GLA's Health Committee. So I'm personally delighted to welcome Dr. Sahota. Welcome, Dr. Sahota. Dr. Sahota, the normal practice is to speak for about 15 minutes and then to answer questions. We are absolutely delighted. We know you're incredibly busy, so we are so delighted to have you join us here today. And we know you're very busy, so we've interrupted something else to get you here. But the floor is yours. Please speak to us on the subject of diabetes and your heart.
Thank you, Keith, for that wonderful introduction. And it's a real pleasure for me to join you this evening. And I'm also very grateful, Keith, for all the wonderful work you do for the diabetes charity, and particularly for your charity called Starlight. Look, I practice in Southall and also Hanwell, which has a large South Asian population. And of course, that's one of the risk factors for diabetes. The people who are from the South Asian community are much more likely to get diabetes, and there's a genetic component to it. My subject to this morning is diabetes and the heart disease. And what we need to realize is that diabetes is when your sugar levels are not controlled. There's a hormone produced in your body called insulin by the organ called pancreas, which regulates the amount of sugar which is in your bloodstream. The insulin helps to carry the glucose away from the blood system into the muscles, into your organs, so you function. And the petrol of the body is glucose. Everything you eat is converted into glucose. So glucose is the currency on which the body operates on. And the regulation of glucose is important through the hormone insulin. Now, people who are diabetic, there are two types of diabetics. One is called type 1 diabetes, which is where you don't produce enough insulin. And that is often presented in the young people. And the type 2 diabetes is another word for it is called maturity onset. What that means is that you are producing insulin, but the body isn't responding to the insulin. You've developed what's called insulin resistance. And of course, it's through that mechanism that your glucose levels are increasing. When these levels go up, then they have an effect on the lining of the blood vessels. And so diabetes is really a disease, right, of the inner lining of the blood vessel, and that is called the endothelium. The inner layer of the blood vessels is the endothelium. And when you get this abnormal high levels of glucose in your blood circulation, it starts to affect the lining of the blood vessels. And it's the damage to those linings that causes the complications of diabetes. And that's why we call diabetes a cardiovascular disease, a disease that is affecting the vessels of your body, and particularly the cardiac vessels, but they're small vessels and the ones which are providing muscle, providing blood to the heart muscle, that they have a big effect. And these complications in the lining of the blood vessels, that cause damage to the blood vessels. It then leads to the deposition of cholesterol in your blood vessels, and then when these plaques of cholesterol in the blood vessels, when they rupture, they then lead to a clotting mechanism going on in your body, which then triggers off something like a heart attack. So that's why, for example, patients who are diabetic, we're screening them for their kidney function regularly. We're screening them for the back of the eyes. We're screening them for their circulation. And the complications of diabetes are things like that. You get early heart attacks, you will get kidney damage, you get peripheral vasculation problems, that you end up having amputations, and also you get what's called diabetic retinopathy. There's damage to the blood vessels in back of the eye. So really, diabetes is a disease that's affecting the blood vessels of your body. The sad thing in a sense, right, is that the South Asian community has the largest preponderance of it, and there was some statistic that by the year 2025, that a quarter of the people in the world who have diabetes will be South Asians. And that means that we all know someone in the family who has diabetes. We have a family member or a relative. And somehow people think that this is just something which is bound to happen to us. It's something that we're going to get. We don't take it seriously. But this is far from the truth. We can do something about it. We can do something into prevention. And one of the big factors we know that is linked with diabetes is the amount of fat in your body. Now, the fat isn't just acting as an extra mass in your body, but the fat itself is acting as a metabolic organ. It's an organ is acting an organ which is interfering in the working of insulin and in insulin resistance. We used to measure people's BMI, which is the ratio of the mass to height, and the normal ratio is between 90 to 25. But in diabetic patients, it's raised. But in the South Asian community, we realized that the BMI is not a good measure of the risk factors. And what we should really be measuring is abdominal girth, right? Your abdominal size. Because the fat around your abdomen is deep fat, and it's called brown fat. And it's the one which is having the most impact on your effect of your diabetes. So losing weight is important, but also making sure that we don't put on too much fat around our abdomen, around our belly button, is also very, very important. And then, of course, making sure that we exercise regularly, that's important. If you are told by your doctor that you are getting into resistance, then you should be giving up glucose. And the other thing is to take as much as these carbohydrates as possible in your diet. Try to avoid as much of potatoes, bread, pasta, and rice. Have a very low diet of that. And some people actually survive on a low carbohydrate diet, and carbohydrates isn't that important part of diet. But I mean, we need some carbohydrates, but not too many. And the difference between things like our cereals, things like our fruits, they give us a quick surge of glucose when we eat them. But carbohydrates give us glucose on a long-term basis and a slow release, and therefore they hang around in our body for a long time. So it's very important. And the other, of course, thing is that the South Asian community, we use a lot of sweets. Sweets are really packages of sugar in a colored form. And I think it's very important that we don't eat so many sweets. We don't eat so many. And when you want to give gifts to people, it doesn't have to be laddus or barfi or rasmalai. We can give other forms of gifts, and things like nuts, dry nuts. They're very important form of gifts, and they're very good nutritionally. So I think we need to think about our diet, think about our livelihood, I think about our daily lives and exercise. And if you have a family history of diabetes, then you're more at risk of this. And there's some women, for example, who only develop diabetes in their pregnancy, and that's called gestational diabetes. And these are women who become diabetic when they're pregnant. They may not be diabetic when the pregnancy is over, but they are more likely to become diabetic later in life. So it's a very important risk factor for them, and it's very important for them to do something preventative about it. And I think preventative is to make sure you don't get overweight, don't put too much fat, take some regular exercise, and make sure you also manage your cholesterol. The other thing is cholesterol and diabetes has a very close correlation. As I said, that the damages to the inner layer of the blood vessels and the deposition of cholesterol takes place there. So I think we need to make sure we have a low-fat diet, low-sugar diet, particularly diabetic. And the other, of course, thing which I see my patients doing is saying, "Oh, we've been told that we don't want to go on tablets because we'll get hooked onto them." Look, the tablets are very important because they control the effectiveness of your insulin. Unfortunately, the degrees does progress. Between the time of diagnosis to ending up with insulin injections is about seven years. But we can delay that. When you're, first of all, what happens is that you are producing insulin, but you're not responding to it. That's type 2 diabetes. A time then comes with the liver, so the pancreas is very exhausted and stops producing the insulin. Then you have two conditions. A, you aren't producing enough insulin. Secondly, the insulin you're producing isn't effective in controlling the blood glucose. And therefore, then you end up having needed injections and having the tablets. So it's very, very important that we slow the rate of progression. But if you do progress to need insulin, then it's not your fault or your doctor's fault. It's no one's fault. It's just that the disease has progressed and you need insulin. So if the doctors advise you to go on insulin, then you need insulin and the tablets, and you must of course comply with your doctor's looking after. So I hope this is a broad bird's eye view of diabetes, and I'm happy to take questions, and I hope that we can have a fruitful discussion in the next few minutes. Thank you very much.
Thank you, Dr. Sahota, for that presentation. Few questions have been submitted to us. One is the first one from Mr. Amin, who's a type 2 diabetic. Is, can diabetes cause heart failure?
Can diabetes what?
Cause heart failure.
Can diabetes cause heart failure? Yes, it does, and it causes heart failure because it's affecting the small vessels of your body, and it affects the circulation of the arteries which are around the heart. So when the heart is starved of blood, then you get something called angina. That means that your blood vessels providing the oxygen to the heart muscles are narrowed, and therefore when you go for a walk or go up the hill, then you start getting a chest pain, and it can be either be treated through angioplasty or through medication, depending where the blockage is. But of course, when the heart is starved of oxygen, then the muscles starts decaying, and the heart muscle starts getting weak, and that is what heart failure is when the heart muscles are weak, they aren't pumping as effectively as they used to. So the answer is yes, you can do, and that's why we are very keen to control diabetes so that they don't progress to heart failure.
Thank you. We've got a question from Geeta, and she's asking, does visceral fat increases your chances of type 2 diabetes? Does visceral fat high visceral fat increases your chances of type 2 diabetes?
I didn't catch the question very clearly. Can I hear it again, please?
Yeah, sure. The question is from Geet, and she's asking, she's not a diabetic, but she's asking, does visceral fat, high readings of visceral fat increases your chances of type 2 diabetes?
I'm afraid I didn't get the question.
Visceral fat. She's asking about visceral fat. The fat.
Visceral fat. Oh, sorry, visceral fat. Yes, of course. Yes, that's what I refer to as brown fat. There is fat of two types. You're absolutely right. Visceral deep fat, which is what we call brown fat, is much more diabetic. I mean, that it causes much more diabetes. Yes, of course, visceral fat is more important than the superficial fat, and it has a much more diabetic causing effect to it. So yes, deep fat is very important, and you're absolutely right that the deep fat is more difficult fat to get rid of, right, in our body. And so when we start losing weight, we'll start losing weight from the superficial fat first, and then we get deep fat. But you're absolutely right, deep fat is much more dangerous than the superficial fat.
Thank you. A question from Shobna. She's asking, can diabetes cause irregular heartbeat?
Can diabetes cause irregular heartbeat? Again, of course, it can do, and the reason for that is because it's the arteries which supply your blood to the heart muscle. They're called the coronary arteries, and when they become narrow, when the heart muscle is weakened through the narrowing of the vessels, or enough blood isn't reaching, then you can get something like atrial fibrillation, right? Or which is one of an irregular heartbeat. And ischemic heart disease is one of the main causes of atrial fibrillation, of abnormal heart rate. And of course, the other thing, atrial fibrillation is closely linked with the incidence of strokes. So if you ever get atrial fibrillation, then we need to treat it. But the root cause of